Good afternoon, everyone. Thank you all for taking the time to join this webinar today. Um, to learn more about the project that we'll be describing here. So today we'll be talking a little bit more about an opportunity to participate in a research study and also a quality improvement opportunity for your clinics centered around diabetes self-management, education, and support services. I'm Dr. Mary Lacey. I am the principal investigator of the research study. And with us here today is also Jessica Elliott, who's the collaborative director of the DSMES, Diabetes Self-Management and Education Services. I'm just going to call it DSMES for short, of the DSMES Collaborative. And we're going to be sort of splitting up today and talking about two different parts of the project together. And before I start, I just want to acknowledge that this is work that has stemmed from years of work from the Kentucky Department of Public Health and the Kentucky Diabetes Prevention and Control Program. It's also a partnership with KHI, the Kentucky Health Information Exchange, who provide a lot of the technical support for this project. So we'll start with just a really, really quick introduction of what is diabetes self-management, education, and support, and why does it matter. I imagine many of you are familiar with what this is, but just in case, I'll give just a tiny bit of background. So as I said, DSMES for short, it's an integral part of diabetes management. And so DSMES is a series of educational courses that are lumped together and delivered by accredited or nationally recognized programs. It's an evidence-based program that teaches people who are living with diabetes ways to effectively manage their diabetes. So it provides them with the skills they need to effectively manage their own, to effectively manage their diabetes in collaboration with their clinician, of course. DSMES has been linked to a number of improved patient outcomes, including better glycemic control or improved hemoglobin A1C, a reduction in mortality, reduction in a number of longer-term complications, and also improved quality of life because those patients feel empowered to better manage their diabetes once they are sort of adequately educated on how to do so. It's also associated with a reduction in a number of healthcare utilization metrics, so lower healthcare costs, improved adherence to medications, and decreased spending on hospitalized care. It's importantly integrated as one of the main components in the American Diabetes Association Standards of Medical Care and Diabetes. So every year the ADA puts out current clinical practice guidelines for diabetes care for patients living with diabetes, and provision of DSMES to patients is one of the highest level of evidence guidelines that the ADA puts out. And so you can see here, we've included a little excerpt here of what the ADA recommends. And so every person who has diabetes, according to ADA clinical practice guidelines, should be receiving DSMES services. We know from many studies that have been conducted over time that not all patients living with diabetes do receive these services. Estimates suggest that something around 10%. Jessica, if you can go to the next slide. So this project is an effort to raise awareness of the importance of DSMES and also work with clinics to improve the referral services out to DSMES providers. So this current study is an NIH-funded research study, and it builds on, as I mentioned, work that the Kentucky Department of Public Health has been doing for a number of years, that partners with their Healthy Living with Diabetes program across the state to provide DSMES services to patients living with diabetes free of charge. And so this particular research study uses a collaborative model, partnering with healthcare systems to do a quality improvement project to do a small test of change around increasing clinic level referrals out to the DSMES providers. There's also a component of the project that involves health information technology, so integrating appropriate communication services into the healthcare system's EHR to allow for this communication with the DSMES providers. Currently, what we're doing is we are pilot testing this project. So the participants, the clinic participants who would be involved in the current study would be a part of a pilot test of this system. That the goal would then be to scale it up across across a larger number of clinics across the state of Kentucky. And so currently we are in the process of recruiting healthcare systems who are interested in being part of this opportunity. And so it would involve participating in the Learning Collaborative, which Jessica will go into a little bit more detail in a minute about what that involves. And selected organizations will receive the health information technology support to integrate this communication service between the DSMES providers and their clinic, and then also will be participating in the 9-month learning collaborative that will be led by the KREC team, which we'll discuss in a minute. And so clinic locations at each of the participating healthcare organizations will complete this collaborative, where we'll have 3 different learning sessions where we provide a lot of context around the Learning Collaborative system itself, and then also support from our quality advisors from the KREC team as well, that with the overall goal being to increase the number of patients from within your healthcare system that are being referred out to receive DSMES services. So I think with that, Jessica, I'll turn it to you to go into the nuts and bolts of the Learning Collaborative. And I'll mute myself.
Thank you so much. Thank you. Alrighty, well, again, welcome and thank you so much for joining us today. I'm one of the Quality Improvement Advisors at the Kentucky Regional Extension Center. And again, as Dr. Lacey mentioned, I'm also going to be the Collaborative Director for this Learning Collaborative. And so I just wanted to take just a couple minutes to talk with you about some of the nuts and bolts of what we would like to do as a part of this collaborative framework. And so the first piece that Dr. Lacey talked about is that we are looking at healthcare organizations. We're right now, again, this is a small project. We're looking at healthcare organizations that have perhaps 3 to 4 clinical units. And by clinical units, we are talking about clinic locations. Those locations can be geographically separated, or they could be housed within a physical structure, but they're independently functioning clinical units. And we would have about 2 of those locations that would be focusing and participating in the actual collaborative work itself. And then we would have 1 to 2 of those locations who would actually be part of the control, the study piece. They would still be reporting data, and we would help the entire organization, as Dr. Lacey mentioned, with that health information technology piece, making sure that there is a mechanism for referrals and tracking processes for the entire organization, as well as DSMES resources if you all don't already have those within your organization themselves, if you're not already an accredited diabetes educator, DSMES educator. And so what we are asking organizations to do, these clinical units to do, is essentially form focused improvement teams that are going to be working on improving DSMES referral and completion rates. And ultimately, what we are looking at, as Dr. Lacey touched on, is really about increasing that overall awareness and access. Awareness by our community, but also awareness by our clinicians and providers and patients about the availability of DSMES resources and the need for DSMES resources. Now, the framework itself is going to be based on a 9-month collaborative. And this collaborative is based on the IHI, or Institute for Healthcare Improvement's Breakthrough Series model. And so this is a model that has focused learning sessions where we all come together to have that shared structured learning around quality improvement, specific education around patients with diabetes and improving outcomes, as well as focused education around DSMES and those nuances. And so we come to those learning sessions, and then we break apart for several months in what we call action periods. And these action periods are where we do small, rapid cycle tests of change. And so we repeat this cycle back and forth through 3 learning sessions. And then we're going to have an additional time frame after that, about 6 months, where we're going to be doing continued monitoring of performance. And so The methodology behind this is based on the chronic care model and the model for improvement. This is something that the IHI recommends implementing whenever you're looking at chronic conditions, such as diabetes. And so in implementing this breakthrough series structure, we're going to be following the chronic care model as well as that model for improvement, those rapid cycles of change for that breakthrough transformation and for hardwiring sustainability within your organization. Next, we are going to be working with you around a couple different metrics that I mentioned reporting on monthly. That's going to be, looking at your initial patients with diabetes population that can be found in NQF 59, diabetes A1C poor control. And so we're going to be working with you on measuring and monitoring that data, as well as monitoring your DSMES referral and completion rates. And again, as I mentioned earlier, if you don't already have a mechanism in place for DSMES referrals, that is something that we will work with you on to establish and put in place, not only as a part of the collaborative, but as your organization as a whole. So that's just a kind of a brief overview of the framework itself. I wanted to share with you the timeline that we are looking at for the collaborative. So our application window actually kicks off on Monday the 20th. And we will actually post those applications. For those who have attended the call today, you will receive a copy of this recording and the slide deck, as well as a copy of the application once that is available. And then we anticipate having that application window open until the 17th of March. And we would like to have our awards announcement by March 24th. Then that actually enters us into the pre-work phase of the Learning Collaborative. And this is going to last a couple months. And we're going to have a kickoff call on April 24th for those selected participants, those organizations with their 3 to 4 clinic locations each. Will participate in a group kickoff call where we'll just kind of start to really introduce you to the breakthrough series model and get you a little bit more background into the metrics that we're going to be collecting and the reports. And we're going to start a data validation phase. And so this is really to ensure that your reports are pulling correctly, that we have identified the appropriate population of focus. So those patients within the organization that we're going to be testing this intervention on before it ultimately down the road would get scaled and spread to other areas within your organization. And so we will work with you. You'll meet your REC advisor who will be working with you throughout the duration of the project at that kickoff call as well. And then we're going to enter into our first learning session that's scheduled for July. And in this learning session, it's as with all learning sessions and meetings, they will be held virtually. And we will have this learning session over a 2-day, half-day period. And again, this is a time, part of that breakthrough series model where we all come together for shared learning and shared experiences. And then we break off and go forward into those action periods. We'll also have 2 more learning sessions, one in November and then one into springtime of 2024. Hard to believe we're already looking at 2024. But we will be having both of those sessions again virtually, and those will just be half-day sessions that we'll each have for those. And then that will wrap up the intensive learning collaborative process itself, where we'll have an extended 6 months of data collection for study purposes. And so both the participating collaborative locations as well as the control locations within an organization would still have that monthly reporting. Now, during this time frame as well, we'll have monthly educational webinars and meetings. That'll be a group collaborative effort with all of the team. And so your quality improvement team would be on those calls doing report outs, and then also attending the educational event that we have as well. It's usually about an hour a month is what we're anticipating. And then we will have advisor calls, so technical assistance calls available every single month with you and with your team to help you plan your test of change, your PDSA cycles, your plan, do, study, acts, and also to help you identify other potential interventions, help you work through barriers, and help to bridge those gaps with those referrals and that attendance piece. The last thing that I do want to mention on this slide is that we understand that this is a lift, that this is time that you are taking out of clinic to come to attend our sessions, to pull data, to monitor data. And so as a result, to help offset some of the costs of participation, we are offering up to $12,000 per organization in order to participate in this program. So if you have 3 to 4 organizations that are going to be participating, or 3 to 4 clinic units or locations that are going to be participating, you can receive up to $12,000 for your organization's participation in this learning collaborative. So with that, I want to give us some time to answer some questions. So if you find the Q&A box on your screen, if you have any questions today for us regarding the structure of the collaborative, the study itself, any of the methodology behind it, please feel free to take a moment or two to enter those questions in for us. And while you are ruminating on those, I just want to again do another quick reminder that applications are going to be due by March 17th. So that's going to be a month from today. Again, those applications will be made available via email. They will also be posted on REC's website. We'll send out another blog post similar to the notice that you probably received to attend this call or to listen to this informational call today. And then also too, if you want to just reach out to me directly, I'll be able to get you an application as well. And we also want to extend any assistance if you do have questions about the application. If you would like to take a couple minutes to meet with us, we're more than happy to walk through the application with you to help answer questions and to ensure that the information that you provide is accurate, and we can help walk you through that. So we want to try to make this as stress-free for you as possible for you to apply, and we would love to be able to have the opportunity to work with you and with your organization. So with that, I don't see any questions in the Q&A at this point in time, but if you do think of anything, please feel free to contact myself or Dr. Lacey. You can reach us at our emails below. We are more than happy to talk with you, to answer questions, anything that you need with this. And I'll hand it back over to you, Beth, if you have anything else you'd like to add. Oh, I might need to, there we go.
Thanks. Sorry, I can't unmute myself. Yeah, if there are not any questions, please reach out if you have any questions after you've had a chance to sit with us. We're excited to launch this pilot project. I think it's a great opportunity for clinics who are interested in improving their diabetes care to get some hands-on assistance from the folks at REC, and also get connected to a lot of resources that the state has developed around DSMES services for patients living with diabetes. So if there are no questions, then thank you all for joining today. Please reach out if you have any questions about the application process or would like additional information in a different setting. We can do that as well.
Yes. Thank you all again for your time, and please feel free to reach out. Thank you so much.